Pediatric and maternal clinic services across the island have been disrupted owing to a strike by family health workers for midwives. The director of the Family Health Bureau of the Ministry of Health, Dr. Deepthi Pereira, said that medical examinations of mothers providing them with necessary medication and immunization programs have been hampered by the strike action. The island-wide strike action called by midwives is now into its fifth day. The Government Family Health Services Union said that they have withdrawn from all clinical services provided through MOH officers. This includes infant and maternity clinical services, immunization and family planning services. The midwives have also withdrawn from door-to-door services. The strike action was prompted by a decision by health authorities to offer training for nurses in childbirth. Health authorities had reached this decision based on the recommendations of a special committee appointed for this purpose.
The recommendation of this committee do not note anywhere that childbirth training should be provided to nurses who have completed their training at the Nurses College.
The committee has not recommended that they not be provided with childbirth training. This is not something that was proposed recently. If anyone says that it is not good to provide this training as per the committee reports, then I say that they should have their brains examined. Providing childbirth training to nursing students is a program conducted by the Ministry of Health over 140 years as a matter of principle. If that is the case, why are these family health workers on strike? Any intelligent person will understand that if such training was given in the past, then there would be no cause for such a problem to arise. There is a curriculum to provide midwife training to nurses, but it does not equate complete midwife training.
The Ministry of Health has decided to pay 80 million in wages for nursing students who came forward for childbirth training that they offered through the nursing college on the instructions of trade union leaders without any consultation. A large portion of funds allocated for the health sector through the budget has been funneled into the nursing service.
Did some of our people understand the cost of the free health service only when it was decided to provide childbirth training? There is a profit for the government through this, as they only have to pay an allowance now instead of a wage.
Their hope is to provide childbirth training to all the nursing staff and remove family health workers from hospitals. I wish to make this clear at this instance.
Not a single nursing union has called for family health workers to be removed from labour rooms or from field work. In that case, it is evident that their intentions are a myth. A statement had been made that doctors would be brought from India to conduct this training program. But what is the procedure to obtain persons from India who are not even in the public service to come here and provide training? There is a problem as to whether they are engaged in a transaction of some sort with foreign nations. The request we made was that if doctors here are not willing to conduct childbirth training for nurses, then the government should at least provide sponsorship to obtain doctors from India to conduct training. They are trying to turn this around and distort the problem. The Family Health Workers Union is functioning as a cat's paw of the Government Medical Officers Association and is at this time working to achieve their own ends. That is a false allegation. It is simply an allegation made by certain trade unions that have no understanding of the public service. Persons who obtain the highest marks at the advanced level examination, the most intelligent people in the country, become doctors. Therefore, there is no chance that nurses can challenge their position and the privileges they are entitled to. Meanwhile, the Epidemiology Unit of the Ministry of Health says that they will not allow the strike action by family health workers to undermine the immunization program. The Epidemiology Unit notes that if the strike continues, they will look at alternatives to conduct the immunization program. Secretary to the Ministry of Health, Dr. Nihal Jayathilaka, said that the decision to provide childbirth training to nurses from the 2009 B batch will not be suspended in spite of any pressure brought to bear by the unions.